two last one because I felt I squeezed them out.
Okay, we're live.
Oh, yeah.
Yeah. So for everyone who's listening, what we're talking about is, getting this training out there, this exciting training. It was a rush, it was a squeeze, and it is amazing. It is amazing. I have watched every single lecture in the Nutrition Network, professional training for sugar and carbohydrate addiction, developed in association with Bitten Johnson. She was the brain behind the training, and does 4 lectures in the training herself. But wow, just the caliber of lecturers in this training, Bitten. We're going to go through and discuss each lecturer. Well, not can't get through all the lecturers, but many of the lecturers, many of the topics in this live today, so that anyone who wants to sign up knows what they're getting, what kind of content there's going to be, what things were discussed. I have watched it all now, and I'm excited to ask some really pertinent questions and discuss some really interesting topics that came up, things that were new to me. And I've been in the low carb space for a very long time now, and in the addiction space for not quite as long, but definitely been learning from Bitten along the way. And, I learned a whole lot of really interesting, exciting new things from this training. And I know that all of you will as well. So basically today, Bitten, is the launch.
I know, it's so exciting. Yeah, I'm holding my breath. And I have to say, let me tell you, you are a dietitian. I mean, I used to really run when they came around in the old days, because they told my clients stuff like have 1.5 deciliter of ice cream mid-morning, mid-afternoon to curb sugar cravings. I mean, I've heard so many stupid things you wouldn't believe it. And they did not believe in sugar addiction, and you have embraced it with all your knowledge. And my students love your training in my training. They think it was one of the best lecture ever about food. So you guys ought to know that you are an outstanding dietitian. You're up here in my world.
Oh, but wow. And that coming from you is the highest of compliments. Thank you so much.
Well,
so much.
You're welcome.
That really, really means a lot. Thank you. Well, I mean, coming from Bitten, who is the expert on sugar and carbohydrate addiction, she's amazing. And she brings this whole panel of experts to the training. People who often hide in the woodwork. I mean,
they do.
I didn't know that some of them existed, but I learned the woodwork ones were the ones that I actually learned the most from. So I'm going to tell you a bit about them. One of the things is about oxytocin. I mean, that was a mind-blowing lecture for me.
I know.
On how we always know that, yes, people eat for comfort. We all know about comfort eating, but we don't understand the physiology behind it. And I did not understand the physiology behind that until I watched this lecture. Absolutely amazing. It was by Professor Kirsten, right?
Kerstin Ugnes Moberg, yeah.
It's very difficult for the English mouth to say that name.
Yeah, I know.
But
you can say that. It's okay.
She's amazing. So we'll go through some of the stuff that she says. I have questions about that. The physiology that Dr. Paul Early brings to the table is just exceptional, absolutely exceptional. To have such a giant in the field like him in this training is amazing. Obviously, the giant in the field, you, Bitten, contributing such crucial lectures, which we'll talk about: the shame, the stigma, the relapse, diagnostics. We got Borge Dahl. Is that how we pronounce his name? Borge Dahl?
Börje. Oh, that's another horrible Swedish name. Börje. I know, it's horrible.
Very, very difficult for our mouths.
We call him Bill because nobody can say Börje, so you can call him Bill. He's used to that.
Okay, well, he's also amazing. It takes us through a whirlwind tour of diagnostics. It's just absolutely amazing. And then addiction in the family, which we have 2 lectures on in this training. Absolutely amazing as well, because it affects addiction isn't just the addict's problem. It is totally intrinsically the family's problem. And then Annika goes into discussions around what it's like in childhood, where addiction starts, how addiction looks like in childhood. It's amazing because any of us out there who are mothers can look at our child now and say, okay, I see some serious addiction signs, or I don't. And
Exactly.
that's,
Yeah. It's
yes,
good to know when you don't too. What are you going to look for and be
yeah,
alarmed, and when can you let go?
yes.
That's very important. Yeah. Just
And
because somebody likes sugar doesn't mean they're an
yes,
addict. And that is the
everybody likes
skill.
sugar.
Yeah. But the skill is to know when should I be concerned and reach out for help or start doing something, and
Exactly.
when can I let go? Yeah. Very important.
And what parents can do, what you can do as a
Yeah.
caregiver,
Yes. Yeah.
and she also gives such amazing guidelines into family systems as well. And I found that quite, I found with this whole training that I had to do a lot of internal looking,
Yeah.
at my own family dysfunctions.
Yeah.
I always thought I came from such a functional family, and
Yeah.
then you look at these
We
things like,
scrape
oh,
on the surface and then we see, ooh, there are some monsters lurking here.
yeah, there's some dysfunctions there, and then once you recognize them, once you acknowledge them, like anything else, then you can start to do things about it. And so,
Exactly.
yeah, it's just amazing. So I think I'm hopping all around now with you, Bitten, but
Yeah, I
let's
hear you hopping around.
there's so many amazing lectures in there. But I think let's start being a little bit more systematic. And let's go maybe topic by topic and go through a few topics that are covered so that everyone kind of gets a better idea of what they'll be getting on this training and why it's so amazing, why I'm so enthusiastic after doing the training. Okay, so Bitten, I think everyone knows who you are. I hope after all the lives we've done. But
Yeah.
Bitten Johnson is a registered nurse, but more importantly, she's an addiction expert. And she developed the sugar diagnostic tool. She runs groups, training. She's been doing this for such a long time before anyone else listened. But finally, some of us are listening. And Bitten's able to collaborate with us and hand over the baton to a certain degree so that we can all actually finally get this unrecognized disease into the spotlight to help people, which is what Bitten's been doing for so very long. So absolutely privileged to have you on here again. And as I said before, Bitten developed this training with Nutrition Network. So such an honor. For those of you who don't know me, I'm sure you guys know me. I am Tams Murphy. I'm a registered dietitian. I'm also head of content at Nutrition Network. I'm a Nutrition Network lecturer, and I get involved in all the Nutrition Network things. And I'm here today to talk about this amazing training launch on addiction, professional training for addiction. So, but let's start by asking the question, why this training? Because what makes
Well,
this training, what makes
well,
it a gold standard?
I've been a clinician for 32 years with these people, and I didn't choose it. They choose me. I started telling them about my own struggle with
Yeah,
chocolate and ice cream and trying to quit and, all that kind of
yeah,
stuff, and how hard it was. And they came to me and they called me and said, "Could you help me? I'm a foodaholic." That's how they
mm,
expressed it. And we didn't have the science or anything 32 years ago. We
wow,
couldn't
it's a
even
long
spell insulin. Can you imagine?
time.
And it was such a secluded little field, not connected to the rest of all the medical fields. Everybody
Mm,
was, the kidney doctors was only kidney, and the head doctor only head. Then it was not, you know. And then I learned that addiction is a very complex, confusing illness that affects
mm,
everything. And as you said, it's not only me, it's family, and actually it goes several generations back. When we work in treatment, we look 4 or 5 generations back and we can see patterns. And the shame, you mentioned that. Shame is so profound with this, which is totally unnecessary because it is a brain illness.
mm,
You didn't cause it. That's very important to understand. So the shame is so horrible that people have about this, losing control and not controlling alcohol or food or whatever. And they end up, struggling in quiet, shamed, and, overweight, obesity, very much body shame. And, it's your own fault. Eat less, move more, blah, 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 or pills or powders or surgery or whatever. And of course, that doesn't work on a brain illness. So, when I started working with these people, I found that they were lovely to work with and they responded. And we learned together in the beginning, okay, what is this all about? And then I knew about alcoholism since I've been in recovery for alcohol for almost 40 years. And I went to the best treatment center in US, 1985. And that's where I got taught the basic, the ground for everything, even though we didn't. Well, they did start to have I went to lectures about dopamine system and all that, but we didn't have all the rest, microbiome and reptilian brain and blah, blah, blah. But anyway, so that's what I built it on. And it works, it's the same illness. So, and then I found out that so many people, it's unbelievable, are afflicted by this, or a relative, or a loved ones, or a child, or whatever. So it's huge, huge. And still, nobody dared really lift it up on the table. So that's why I started talking about it and talking about it. And I see that that is de-shaming. To explain what it is all about, the science, the methods we use to treat it, the support groups where people go together and help each other, all that together is lifting it up on the table. And the traditional medical field has not wanted to touch this because they say, many doctors said to me, I don't want to work with these people because they don't do what I tell them. Oh, interesting. Maybe you tell them the wrong things because you don't understand what the problem is. They don't want to listen to that. But, when I met you guys and saw that you want to take this into the medical professionals, that was a blessing. I can't explain it in any other way. I thought, finally, I tried for years, and now here these people say, oh yeah, we get it. This is important. Of course we're going to talk about this. I was just, am I dreaming? So that's what happened, and that's where we are right now, that we are taking it on a very different professional level into the medical field. Doctors, nurses, dietitian, nutrition coaches. We're really taking it in, not like something weird that we, strange that, oh yeah, we should talk addiction to. It's like, this is food, this is keto, this is addiction, this is blood pressure, this is diabetes. It's just in there on the same level. And that is amazing. That you're the first group doing that. So yes.
As it should be, Bitten, as it should be,
Of course.
Yeah.
It hasn't been intensive.
No, and you've been battling this for decades. It's crazy, crazy. And the thing is, this training is called the professional training in sugar and carbohydrate addiction because it is, as you say, it is for professionals. Yes, anyone can do it. Anyone can do it. But it is
so for your own sake. You can learn for you only and about your illness. It's going to be very rewarding to do that.
Exactly.
It is meant that, because I talked to a colleague the other day and we said, where does these clients go when they've tried every, magazine diet, every pill in the health food store, every method, diet, pills, powders, blah, blah, blah. They've tried and they fall and they fall. So they become sicker and sicker. Where do they go? To the GP. And, if the GP doesn't get it and refer them to a professional, they're going to lose faith, lose hope, thinking that it must be me. I'm probably a very weird, bad person. So they quit asking for help and they become sicker and sicker and sicker. So I think that GPs have a very important role.
Very, very important.
Yes, very, very important role.
And we talk about that in one of the lectures as well. The doctor's role
Yes,
in sugar and carbohydrate addiction, the
yes,
GP's role in
yes,
recognizing it, screening for it, and what you do about it. It's in
yes,
there, you know. And I think
yeah,
so this training is so important because yes, for individuals understanding, but for clinicians, for doctors who are the first port of call when a patient is something wrong, looking to be referred to somewhere to be helped, that the doctor recognizes it. Dietitians who see a patient who just doesn't lose weight again and again and again. Why? It's
you know,
very likely
you know
because
what? The
yeah,
interesting thing is when I do the sugar diagnostic and I do my PAE assessment where we ask hundreds of questions because we want to map out exactly what's going on. Because the more I know, the better treatment plan I can help somebody with. Of
yeah,
course, you know,
yeah.
I wouldn't treat cancer in blindfolded.
Yes,
I would do a lot of
exactly.
things. And then if I go back and talk to the doctor together with the client, which happened many times, the doctor looked shocked at me and they said, "How did you get him or her to be so honest? Telling how they really ate and the suffering." And the answer is very simple. I asked the right question. And
Yeah.
when people have done the sugar, they tell me, nobody asked me these questions.
Mm,
Nobody saw me, heard me in this way as we do in this instrument. That is mind blowing too, that nobody
yeah.
cared to go into this field, because they think it's integrity. I can't ask you, how do you really eat? Are you up and eating at night? What food can't you stop eating? I mean, we ask a lot of questions.
And you
And
learn what questions to ask in this training, right, Bitten? We learn
exactly.
what questions to ask here.
Exactly.
We
Yeah.
learn about how to screen because
Yes.
diagnosis is so important.
Yes.
Without diagnosis, there is no turning point for clients. And I think that's something else that, all the lecturers got across so well in this
Hmm.
lecture.
Yeah.
Particularly you and Bill, um, because both of you say that without diagnosis, there can be no appropriate treatment because you don't know what you're dealing with, right?
Yeah. Well, Börje has a beautiful saying:
Mhm.
without a diagnosis, addiction is homeless. I
Wow.
think that is, I get the chills saying that sentence. I quote him on that, and I think it's so beautiful said. And
Yeah.
diagnose comes from Greece, meaning shared information. A lot of people are against the diagnose, but
Yeah.
I do this to get. I don't sit behind the desk and do a diagnose on a client. I ask them questions, 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 and we
Yeah.
do it together. That's the
Yeah.
trick. We come up with together, oh, here's all the symptoms, then it is addiction. And the client said, well, that's me. They cry from relief. I finally know what's wrong with me. I thought was a nutcase. Well, you're
Well,
not a nutcase.
finally they find a home, right?
Yeah,
If
right.
a
Yeah,
diagnosis,
yeah,
without a diagnosis, addiction is homeless. With a
yes,
diagnosis, it has a home. And as soon as
yeah,
as soon as you have a location, you can do something about it, right?
yes, yep,
Yeah. So I think what's amazing about this training is that you learn the questions to ask. You
yes,
learn how to actually deal and ask the right questions, as well as then get long-term recovery frameworks, and real-world tools, scripts, and even coaching strategies
yep,
to actually practically
yep,
help people who are struggling and who often can go through all of their life not knowing what's wrong with them, thinking it's a psychological, weakness rather than a primary disease, a neurobiological disorder, which is what it is. But Bitten, I wanted to go on into kind of talking about the brain a little bit because we do that in the training, right? What are we actually up against in sugar and
well,
carbohydrate addiction?
any addiction, but it starts with sugar and carbs, since that's very early exposure. Could be in the womb, could be as a baby, toddler, on and on. So what I love teaching my clients is about the different parts of the brain: the prefrontal cortex, the reptilian brain, the neocortex, and limbic system, and all that. And what clients and society doesn't understand, how the brain gets so hampered, faulty wired, which causes addictive thinking, addictive feelings, addictive behavior, which, I call the red dog, that little monster. And I think Paul Early is one of my absolute favorites to explain this in a more, he's a doctor, so he can explain it in a much more medical terminology, because I explain it basic, drawing the brain and parts to the client, because they have to understand, why am I behaving so crazy? Why do I feel so bad? Why do I have mood swings? Why do I get so angry sometimes? Why do I do this to myself that I promised myself not to do? And both me and Paul, we are sort of the same age in training. I met him many years ago in US, and we understand the impact a psychoactive substance, no matter which one, how it really destroys the brain. So it is having these faulty wirings, and that is very important in releasing shame. Again, I'm not being a bad person. I behave this crazy because my brain has been so crazy, faulty wired because of the psychoactive substance. There is no connection between these parts. My prefrontal cortex is dimmed down. My neocortex is numb, shut off. My reptilian brain is in overactive drive, screaming, eat or you die, eat or you die. And I think this is something that other professionals has to understand, the impact a psychoactive substance has on the brain. And I feel that it's always been psychology and behavior, not the physiological faulty wiring that makes us think, feel, and do crazy things, because there is no connection, you know. And that's why treatment is long and takes forever and is hard, and you need the right nutrients to do it, because you have to rewire your brain. You have to do brain bypass. And Paul is absolutely, you can listen to him for as long hours. And his books, his 2 books, is a must for my students. They're mandatory for anyone training with me to understand. Say red dog, and he says addict brain, one word, addict brain. We mean exactly the same thing. And of course, that makes us, feel miserable and feel that we behave in a crazy way, and we don't know why. We think I must be stupid or wrong with me, but I'm not connected yet. And that's why recovery takes a long time to reconnect. You have to create new neurons. You can't take away the old ones. You can't, cure this illness, but you can rewire, brain bypass, new wiring. So that's very important.
I love that, Bitten. And this is just, everybody, this is just the tip of the iceberg
Yes.
about what gets dived into in this training. It is amazing. It really blew my mind. Yeah, Paul Early is just such a worthwhile lecture. It's actually relatively short. The amount of information that gets packed into that so succinctly.
Yeah, I know. He's skilled. He knows his topic. He knows his topic.
Absolutely. You know your topic when you can explain it in a way that everyone understands relatively quickly. Then you know. Yep. As soon as you become too verbose and then people aren't entirely sure.
Too many words, you lose it.
Whoa, exactly. Yeah. And I think so many topics are covered when it comes to the neurobiology of addiction. And I think like things from the reptilian brain, as you mentioned, to
very important.
Euphoric recall and dopamine versus other hormones and neurotransmitters that are involved. It's just a huge topic. It's a huge topic. And you see in the lectures how, the reptilian brain basically hijacks or prevents the other higher functioning brain sections from working, and then you understand, you're like, not like, how could such a clever person who's thinking, who has good willpower, not just control this thing? Well, because the brain is being hijacked. Dr. Early calls it the mesolimbic dopamine hijack, which is a really sciencey way of saying that, right?
Yeah.
And then something else that you said, but which we have a whole lecture on, right, in this training, is addiction interaction disorder,
Yep.
which Roger Nielsen talks about, right?
Yep.
And that is powerful because it's not, there's a lot of people who say, okay, well, sugar addiction is contentious. Okay, it's really not. It really shouldn't be. But the fact is, they're all one disorder. They're all one disease. And
I
that
found that out. Yeah, I did, both sugar and addis on all my clients when I work with treatment. I did a small survey on 202 clients. 74% were alcoholics. But, they weren't the classical alcoholic that you see out on the street being drunk. But every time these people that were sugar and carb addicts had alcohol, they lost control and they couldn't stop. Maybe it happened 2-3 times a year, but when alcohol, that psychoactive substance, hit their brain, the reward system too, the same phenomenon happened. They lost control and did crazy things. So and we looked further, we saw that there was a lot of what in the beginning, when I started many years ago, we said cross addiction. And usually it was between, certain tranquilizers, sleeping pills, opioids. But now we see it is with behavior addiction. So, this is what Roger talks about in a beautiful lecture, because he's an expert on that. How it is one illness, many outlets. And they can dim each other, they can enhance each other, they can always be like pairings. There are so many combinations. But working as an addiction expert or counselor, you have to understand to screen for other outlets, because we know maybe around 5% of all the clients we have met. In the studies, it says 17, but Roger and I agree it's about 5%. Only one outlet. And then 80%, Gorski said many, many years ago, 80% of all the relapses are due to an unknown other outlet that the client are not aware of. So they take, they work with the sugar and carbs, but they have other hidden outlets. And boom, there you are, back in the sugar carb again, and, really sick. Wow. So you have to understand addiction interaction disorder. Extremely important.
You can't just treat one, right, Kristen? You can't just treat one. You can't just say, okay, well, stop alcohol, but then you are also a sugar addict, and you can't just look at one. You have to look at it as a holistic thing, right?
I've said that for many years, that sugar and drug, prescription pill, any addict should actually go on a keto diet, because that's what's going to heal their brain, minimize craving, minimize relapse. So it's important for any addiction. Not only sugar and carb.
Yeah.
Of course. Yeah.
Yeah. But Bitter, now I think you've just touched on something that's very important. All of us who are in the keto space, many of us may have had the accusation leveled at us that we believe that keto is this magic pill or silver bullet that can cure everything. And I want to assure you all that this is not the case. In fact, in this training, you say, Bitten, if I'm not incorrect, you say that food is just 10% of recovery. And if that is the case, then what makes up the rest? So yes, the keto diet, you have to do it. You have to give the body this baseline to be able to succeed, but it's only the first 10%. Then what?
First of all, most of us never say that keto cures everything. If you're serious and knowledgeable, nobody in Nutrition Network ever said that. We talk about it as, the most important fuel mix for a broken brain and body, because we know that the body physiologically is not made for, sugar, carbs, and a big load of lots of carbs. And I love your lecture about anti-nutrients and oxalates and all that. And you go, whoo, they just want to kill me. They want to kill me. No, but we know it's not going to cure. We know that it is the prerequisite in order to get clarity, because we know insulin resistance in the brain. Today we talk about Alzheimer's connection. We talk about Parkinson. We talk about we have so much science and knowledge about insulin and its effect on the body and insulin resistance. What do you get a high insulin from? Why? Lots of carbs. So you have to lower that. And then we've been scared to eat meat, butter, salt, be in the sun. That's what we're born to do. Hey, come on. That's natural. So, of course, a keto diet is what's going to put the baseline. It's like taking away all the thing that you put in your body that will make you sick. And you start healing in the cell, in the mitochondria, the energy. We know that today. There's 100 years of research on keto. So, I mean, nobody can argue that if they want to read, if they read. And then but those 10%, but it's not only food, it is sleep, working on a sleep hygiene. It is breathing, my passion for the conscious breathing as a stress de-stressor. It is physical activity. We're made to move, we're made to walk. I saw the other day that bird song changes your mood for the better for several hours. No wonder I love to be out this time. There's also many birds there, and green and nature. But we have come so far away from that natural life. So those 10% are the fundamental prerequisite. You have to have them in order to get the strength to do the behavior changes so that you create new neuron connections, new behaviors if you want to keep your recovery, for more than a few weeks, which is not really recovery. So that's so necessary. The 40% that I have in my model is relapse prevention. And we only have to go out in the street, you and I, and we're going to be exposed to this junk food, as I still call it. And we know, and one of the wonderful teachers on that, he taught me so much many years ago, is Paul Early about cue-induced craving. And I think that's more important for us than for alcoholics, because it's not alcohol at the gas station or everywhere in glasses, because the smell, the sight, everything triggers sugar carb addict. So we have to be aware of these things. So then we have to learn craving management. We have to learn relapse prevention, my warning signs, my triggers, and I have to change behavior. That's 40%. The behavior change, very important. And then 50%, if this is going to last more than a few months, you need support. You need other people that have gone ahead of you. So you can ask them and say, hey, how did you, the first time you went to a business event and they served all this stuff? Did you tell? Did you hide? Did you bring your own food? What did you do? So that's where people that already have gone a few miles ahead of us is teaching the newcomers how to do it. So support is extremely important. And also, how question we become, what do you mean keto for everything, blah, blah. So, these people get questioned for, why don't you eat bread? Why don't you can have a little cookie. You get sick if you don't eat sugar, must have it for your brain. So if you don't have people that can say to you, this is what you answer them, this is how you do it, this is what you say, you will, fall in the grip of what I call the food pushers and the saboteurs. And that, I can tell you, is very painful, to be ridiculed, to be questioned, to always be harassed because they think you're a weirdo.
And that's
So
that's where you need a tribe, right? Or you
yes,
need a home.
yes,
And that's
yes,
why it makes sense. You need a
yeah,
support network that recognizes you, that
yeah,
sees you,
yeah.
because you're up against, like you say, if we walk out onto the street and we see all these things, all these cues, all
Smell
these,
it, ooh,
and then we have
commercials,
people.
TV. Yeah.
Yeah, we have these saboteurs, right? And then
Mhm.
it's just so much to go up against unless you have got a stable base, a support structure. So I think, that is emphasized in so many of the lectures, how incredibly, incredibly important that is. You have the biochemical repair, which is the diet, the keto diet. But even then, I just want to say a word of caution, and this is covered, I think, in 2 of the lectures, if I remember correctly. One was by Julie Clark, and one I think was by Dr. Carlos, where they both speak about how you can't do, and maybe even you mentioned it, Bitten, probably no you, but mention that you can't say, okay, well, what do I eat instead of
Yeah,
bread or pasta or
we
rice?
all do. Yeah, we know.
Yeah, exactly. You can't go and look for processed keto alternatives. And certain things that could be, relatively keto, like a keto cake, will still elicit, that sweet
Will
taste.
trigger. Yeah.
Exactly. So it's about doing a sober keto or a cleaner keto.
Clean keto.
You Really, that's so important. So
When
important.
you have an illness, so it's a medical intervention.
Absolutely.
It's not punishment for
Yeah.
us. It
Yeah.
is, if I eat this way, I'll heal. If I don't, I keep being sick.
And I think that's another problem with a lot of people outside of the space who look at keto and the people who judge. If you are on keto to treat a condition, which and yes, it is a diet, but it is also a medical treatment.
Yes.
I was
Yes.
recognized as a medical treatment for epilepsy in children over 100 years ago, but
Yep.
it's since been acknowledged in all the guidelines as a treatment for type 2 diabetes. We know it's being used to treat type 1 diabetes in combination with just basal insulin.
Depression, many mental health illnesses with
Exactly,
very
mental
good
health.
results. Very good results. Yes.
So, from neurological conditions like Alzheimer's to now, from Dr. Sethi's lab at Stanford, showing it's being used effectively for bipolar and schizophrenia. I mean, we have so much going on. And this, as you say, Bitten, I think is very important that people stop saying, oh, just have the cookie because that's just a diet. It is a medical treatment we're
Yes.
talking about here. Absolutely. But now I want to move on and talk about the lived experience, because in this training, Tia Reid shares her own journey from addiction to freedom. And
It's a
I wonder,
miracle.
it
She's
really is.
Yep.
Yeah. But I mean, but a miracle that seems to be replicable, right?
Oh, yeah,
Replicated.
absolutely.
You're
Yeah,
right.
I've seen many.
Because
I've seen many like her.
exactly. We have Julie Clark, who also speaks,
Oh,
and she
yes.
shows her transformation. So there's so many. And those of you who watched the lives before, you will have seen that this is just, it's not only Tia. She's a miracle, but she's a miracle. And there's hundreds of thousands of miracles like her. So, but what can clinicians, like, we included this kind of lived experience for a reason. What can clinicians learn from someone who's lived on both sides of addiction? In other words, pre-recovery, post-recovery.
To really ask the right questions when you have a client, a multi-illness client that she had, pancreatitis, diabetes, she had obesity, inflammation. I mean, if you listen to her, she had so many illnesses and about 20 pills and insulin injections, and she was deadly sick. She was dying. And nobody asked the right question until Dr. Sives came along, bless him, and said, you're probably a carb addict. And she was, what? What's that? That was interesting. Because he knew how to ask the right questions, and then she could get help. So asking the right question, that's what she's going to teach you. And hope, and de-shaming. She has no shame. She used to have a tremendous amount of shame because she thought she was such a bad, miserable failure. And she understands she has illness and she takes care of it. And her hope, she radiates. I love to see her, her smile. She looks wonderful.
She's radiant. She is radiant.
Yes. So
absolutely. Yeah, so I agree, but to actually have the lived experience of the addict, and I feel like it's so valuable. I feel like we overlook it across the board, whether we're talking about autistic spectrum disorder, we don't generally go, we haven't in the past gone and asked people on the spectrum how they experience it. It's rather these high-flying academics or doctors who come in from the side and say, oh, this is what you have. And the same goes for any condition. Addiction is no exception. And I
Right.
feel like this training doesn't do this. This training, but you also are an addict, right? And I say are
Yes.
because you say it's a
Oh,
lifelong
yes.
disorder, whether you have been in recovery for so long or haven't, you know. But you have to speak to someone from the inside to really gain true insight into what is happening. And that's where this training sets that apart. It is not an outside looking in training. The professionals who speak on this have suffered with it, the coaches as well. So yeah, absolutely. I love that element, that truth, that lived experience
Yeah,
must be
we
really.
can say, well, I've been there, or I was even worse than you.
Yeah,
And, walk in my footsteps,
exactly.
that's what they say in US. Look at somebody that has something you want and do as they did,
Yes,
having a role
yes,
model. Uh,
absolutely.
with people like Tia,
Hmm.
look at what she did and do as she did. You can do
Yeah.
it. And she's very hopeful. And she said that I know you can do it. You can do it. You can do it.
Yeah,
Yeah.
absolutely. And that brings me, Bitten, to the whole metabolic interplay, right? Because
Yep.
you mentioned that she had all these things going on. As anyone who listened to the interview, I think it was last week, will
Mm-hmm.
know, so
Yep.
many things. She had all the metabolic things going on,
Yep.
right? And
Yep.
and the morbid obesity and everything.
Yes.
So
Yeah.
there clearly is this metabolic and hormonal disruption that plays a
Well,
role in addiction. Can you
yeah.
talk about that? Because I know you talk about the pancreas as being one of the three key elements
Mm-hmm.
within the
Mm-hmm.
physiology of addiction.
Yep. Yep. Absolutely. Well, to include metabolic health into addiction medicine, that's the best I've ever did. It wasn't when I was doing the training. I don't think everybody works with addiction medicine. They don't talk metabolic dysfunction. It was because I listened to you guys, and well, I Terry Gorski mentioned it to me, and then you came along, and I said, of course, the kind of stuff we drink or eat will destroy our metabolic hormone chain. So it was so natural. That's what I call the method I use is connect the dots. It was the
Mm.
same with integrative functional medicine because they know microbiome better than the traditional doctors. So we need to learn from them. So there are many pieces like that. So metabolic dysfunction is extremely important to understand because that is was really ruining every organ in the body.
Mm.
It gives so many side effects, so many issues, so many problems, which is dangerous in the medical field because you become the diabetes patient or the obese patient or the high blood pressure patient. And that's why I like to talk about you have to look at the addiction, not the consequences. But we have to understand all the consequences. Otherwise, you can't fix them, right? But they go together so incredible much that one has to look at both.
Mm.
So
Yeah,
every time you see
absolutely.
the consequences, you have to look behind and see could it be an addiction here. So you
Yeah,
can't just treat the consequences; you have to treat the
yeah.
addiction. But metabolic dysfunction is, I think, the big traumatic destroying of
Mm.
the body and the
Yeah.
brain, of course, because it
Yeah.
affects the brain. Yeah.
And I mean, one of the key diagnostic criteria of addiction is to continue doing the behavior despite obvious
Negative. Yeah.
negative consequences. And you don't get more negative consequences than those metabolic aberrations or metabolic ill health that we were seeing in people such as
No.
Tia, right?
Yeah.
And that's why it is so key to addiction.
Yeah.
And Dr. Hasina Kaji does a whole lecture on inflammation, insulin resistance, and mitochondrial
Yeah.
dysfunction and the link to addiction in this training.
Yeah.
So I think that's really, really important
Very
to
important to be
understand
included.
that overlap.
nobody should talk addiction without including metabolic dysfunction today, because then you're narrow. I used to say, don't try to see the room through the keyhole.
Yeah.
Step
Yeah.
into the room.
Absolutely. And then I also want to mention, I know this isn't totally metabolic dysfunction, but I know I can never pronounce the names right, Dr. Kirsten um,
It's
Moberg.
okay. We forgive
Okay.
you.
Thank you. I'm sorry. I don't know. I think her lecture was maybe it was even my absolute favorite, possibly because it exposed me to information that I hadn't had before. And at this stage, I've been in the space for quite a long time that I see
Yep.
things,
Yep.
again and again, even though there
Yep.
was so much new here. Her entire lecture was new for me, totally.
Yeah.
And I actually told my husband all about it yesterday, because I was like, wow, I can totally see like these links between oxytocin and all sorts of things I didn't know. And now I know why, like, I really like to eat breakfast together, because it gives me this
Bonding, the
oxytocin.
bonding. Yep.
Yeah, so you start, like, it was an amazingly applicable lecture, but very sciencey for those who like that, very medical. And she builds this picture that eventually shows you how love and affection, physical contact, whether it being, you being held or breastfed as a baby, or being hugged, or whatever it is that releases oxytocin, how you can achieve that feeling from eating. And you can achieve it very quickly by having quick release carbs and sugars. So you get this oxytocin boost, but maybe what you were looking for was social connection. So it's about also, again, the support groups and the connection, and then maybe relying on foods that actually give better oxytocin release, such as fat and protein foods, and get your oxytocin from those foods and from actual connection, rather than relying on this scapegoat of an
Yeah.
oxytocin boost.
I met Kerstin many, many years ago, so we have known each other for years, and we love to discuss this back and forth and what comes first, the hen or the egg, or blah, 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 blah. But some of the things that's very important. I've used the knowledge about oxytocin in my treatment, pressure and
Yes.
bonding, like the meetings, the support groups, the 12-step meetings. It's bonding, being understood, but also how you can, when you eat volume eating, you eat a huge amount, you get a pressure inside your stomach, which releases oxytocin. So that's why people can't stop eating, the volume addicts. But, if you do acupressure or massage, or, hugging and touching on the outside, you can get the same effect. It's pressure on the outside can replace the pressure on the inside. That's amazing. That's an absolutely beautiful tool. And also, I remember the first time I listened to Kerstin was many years ago at a conference called Wine, Violence, and Women, which was very, and she said that, there's a lot of research done on men in our medical field, and the adrenaline, noradrenaline, because that's
Yes.
very really, action, stress. But the oxytocin is the body's biggest relaxation hormone if you activate it. And I thought, what? And here we talk about, if you're stressed, you have to run to yoga, you have to run and do this, and you have to run. All you have to do is lay down and relax, and the body takes care of it itself. It's the same like, carbon dioxide and oxytocin is the two chemicals that you need to increase the most if you want to have a healthy, relaxed life. But it's the same. We view carbon dioxide as bad. It's not. It's very important. So there's a lot of misconceptions, and it's the same here. Anyone working with addiction should have a lot of knowledge about oxytocin, because it's such a powerful tool, and satiety and the physiological things that goes into that, together with insulin and up into the brain. You have to have that in there, right?
Yeah. And there's so much in this training. Having just been through all of it and created the associated text content, the multiple choice questions, the toolbox items that people are going to be supplied with when they do this training to take into their clinical practice, patient handouts,
and
reference
objectives.
guides.
Yeah.
Having gone through all of that, I feel like I need to watch it again and watch it again. And every time I watch it, I will get something new because there's such a wealth of information in this training, guys. I just can't even say that enough.
I think that's important that you watch it. And also, as I say in my introduction, what I want you to do with this training is that every time watch the lectures, sit down after each lecture, reflect over what did I learn here about the illness? What did I learn about myself? It's a very important question.
Yeah.
And what kind of tools did I pick up here? And then maybe you watch it 3 months from now and you ask yourself the same question. So I would suggest that you make a logbook of each lecture and those 3 questions. What did I learn about myself, about the content, and what are the tools? Because you can't read, think, and talk yourself out of addiction. You have to change behavior. And that's why it's so important to have the tools.
And there are, I don't know how many toolbox items, but I think combined with the ones you provided, Bitten, and the ones I've created based on the lectures, I think there are like over 20, 25, 30 toolbox items.
Yes.
Yeah, it's huge. So the wealth of clinical practice guidelines for those clinicians who are going to be, or coaches who are going to be dealing with addicts, but also if you are an addict, to get all those toolbox items, you can actually begin to act, because again, you can't think your way out of addiction. You have to act. You have to do.
You have to change behavior, and that's opposite of traditional therapy. Then you start analyzing the thoughts and the feelings, and then you think in the end you're going to change behavior. But you can't do that with that. You can't do that with the addict brain or red dog, as we say.
Yeah, here's behavior first.
You have to change behavior first. Yeah.
I love that. I love that.
Julie's lecture is absolutely beautiful too, about the reverse tolerance. How in the beginning we have an increased tolerance. I haven't seen the whole, but she and I talk a lot. And then, the longer the illness is, we have, a reverse tolerance. Our body and brain cannot tolerate. So that's why a relapse can, absolutely kill us almost if we go back to eating the way we did maybe 6 months ago. All those amounts, we can't do that anymore because we're going to be deadly sick. And also, like we say about alcoholism, to drink on knowledge is hell. When you have all the knowledge about addiction, then you go out drinking, you feel sicker than you've ever felt in all your life. It's the same with eating. To eating on knowledge, that is incredible painful. So
totally. I totally get that. So, but unfortunately, firstly, I've noticed how dark I've gone, everybody, and I'm so sorry. I do actually have lights here around me, and I don't know, it must be a technical issue with my device, which I will sort out before the next live. So my apologies, but at least you have Bitten's beautiful face to look at. But
it's sunshine in Sweden. It's sunshine in Sweden right now.
Yes, here in South Africa, we're in the dark, clearly.
Yeah, right.
It is actually pretty unpleasant weather this today. But Bitten, I think we've drawn to the end of our time. So I want some closing reflections from you before we say goodbye to everybody. And anyone who does have questions, we don't have much time, but if you do want to put them in the chat, maybe we can get to 1 or 2 of you while I ask for Bitten's closing reflections, which is basically, Bitten, what do you want every healthcare professional watching this and potentially taking the training to know about sugar and carbohydrate addiction? I know that's a huge question, but if you say what would be the main thing that you want them to know?
That they're going to be like a vet when they meet a dog or a horse, i.e., whatever you come, if it is for a foot or a knee or a paw, the vet always asks what you eat. I mean, one of the most important thing is the kind of fuel you put in your body for healing. Real food is the best medicine in the world, and if any healthcare professional or physical therapist or whatever you have, if they always think in that way, what is this client giving their body when it comes to fuel and nourishment?
Yeah.
So I'll ask them if that would be such a natural question at the doctor's office, when you go to your physical therapist and you go to your coach, that you discuss that. And, in a way that is not, of course, shaming, in a way that you say, how can I help you to improve it?
Mm.
Or if you say, that sounds dangerous, could be an addiction, let's go ahead and check that out. If that would be the case, the world would be a dream place.
Yeah. Absolutely. I
That,
love that.
that would be
That
big. That would be big, I think.
I love that. That wasn't what I was expecting, but I absolutely love it. But you always throw these wonderful new things, and I internalize them and take them home because it's so true. You do go to your animal's vet, and they will ask, "What does it eat?"
Yeah,
And then they'll be like, "Okay, well, their teeth are falling out because they're not chewing, or whatever it is."
yeah.
But we don't. You don't. Our doctors
Doing
don't.
this with love, thinking that, I can help you to improve, because if you keep eating this, you're going to hurt yourself. It is a care frontation
Yeah,
instead of asking, hey,
I
tell me
love
what
that.
you eat. Tell me what you eat. You
Yeah,
know, it's a care. I said,
it's
Tamsin, I really love you and I care about you. So how do you eat? Could I help you?
yeah,
You don't say love you to your clients, but I mean, with people you can do. But
yeah.
you see the thing behind it.
Yeah. And that disarms a person. You say that the clinicians, they aren't getting success with these patients who don't listen because they're not asking the right questions, but they also aren't caring enough, to be honest.
Oh,
It's this confrontation, it's this blame, rather than getting into putting themselves in the person's shoes, rather a
mhm.
care frontation than a confrontation. I really
Yes,
love that.
yes,
So,
yes.
Bitten, thank you so much for your time. This is the most exceptional training. Please, please, anybody who has any interest in addiction, take this training. If you're finally willing to or interested in understanding, screening, helping people who
Well,
have this illness with
anyone listening
clarity,
now that has questions about the training,
yeah,
email me. I promise to answer you. Email me
absolutely.
anything. There are no stupid questions. Email.
Yeah. And also, you're very welcome to email Nutrition Network as well, and we will also answer you. So please email, ask your questions, join the training, enroll if you want to understand and help with this very real affliction. Thank you, Bitten, and thank you, everybody. We'll see you again
Thank
soon.
you, everybody. See you soon. Bye bye.
Bye.